Carpal tunnel syndrome is more of an idiopathic condition, so we don't know exactly why. Some people will get that. What happens is along the tendons, there's kind of a thickening that occurs, and the carpal tunnel is a finite space. So as that thickening occurs, the nerve gets trapped or pinched, and that starts causing those symptoms of numbness and tingling and pain. And so some people used to think that, it's all this keyboarding or overuse that tends to cause it. And that we've kind of had some studies later that show that that's not necessarily true. It just occurs in the general population. Some people are more predisposed to getting that and some people aren't, but we don't know exactly why that occurs. We do know what we can do to try to help it though. And so when someone does develop carpal tunnel, there's pressure on the nerve, and so there's a procedure we do called the carpal tunnel release that opens up that space and gives more room for the nerve, and that significantly improves patients' symptoms and discomfort. Carpal tunnel surgery is probably the most common surgery as a hand surgeon. It's also the most successful. The success rate is 98% or better. So the outcomes are very, very good. Some people will ask, well, can it come back? Well, it can come back, but it's not very common. I would say that about 5% of people may experience a recurrence at some point in their lives. It's usually around 10 to 15 years later for those that do. But for the majority of patients, they have the carpal tunnel release surgery, and after they go through the rehab and the recovery process, they're fine. They feel like their hand's back to normal.